Good day. We will now be presenting our nursing journal a nutrition lecture. Our assigned case is about a 2 weeks old diagnosed with phenylketonuria. Our table of contents includes the introduction. Under the introduction, we have the definition, etiology, vulnerable problems, clinical examination or screening. For number 2, we have our case analysis, which is the signs and symptoms, amino acid disorder, and the definition of terms. Number 3, nursing implication, such as the health teaching, and lastly, for the references. And this is our contribution when making this journal. We are the group 5. We are the group 4 with Miss Jalipa Keyselmie, Labrador Rhonalyn, Laurel Joyce, Leviste Azzaleah, with our leader, Losa Marc Macandile Kyla Marie, Serminio Carle, and I, Zablan Vienne Carle. To give us a head start for our introduction, may I call on Mr. Losa.
Alright, so good afternoon everyone. So first we'll be discussing the introduction with the definition of our case, which is 2 weeks old with phenylketonuria. Next slide please. So phenylketonuria, or PKU in short, is a metabolic disorder where there is a deficiency with the ability of the body to properly metabolize the amino acid known as phenylalanine, or PHE in short, which leads up to a buildup of PHE within the blood. As a result, it often causes neurotoxicity, which leads to intellectual disability, delayed speech, seizures, and behavioral anomalies. Next slide please. Now, the causative agent, or the etiology of PKU, is due to a deficiency of the enzyme phenylalanine hydroxylase, which is responsible for the conversion of the essential amino acid PHE into tyrosine, which is the essential amino acid for the production and essential component of melanin and, of course, many neurotransmitters. So phenylalanine, or PHE, eventually accumulates in the blood plasma and at dangerous levels becomes neurotoxic. Next slide please. So for the vulnerable populations, PKU is more often than not found after birth following abnormal newborn screening results. So for the target population, or vulnerable populations which affect PKU most often, are those of newborns or neonates. Now for the continuation of the report, may I call on Ms. Jalipa to discuss the next topic.
So we are now down to the clinical examination and or screening. The Godfrey test is also called the PKU test. This is done to determine if an infant has PKU. This should be done between 24 to 72 hours after birth of the infant, but not sooner than 24 hours or later than 72 hours. This is to prevent possible PKU complication. And after birth, the baby should ensure that has taken in some protein either from breast milk or formula. Next one. And to ensure that the results are accurate, to administer the Godfrey test, it will involve a peak puncture in one heel of the newborn or infant, and then use the Godfrey card to collect the capillary blood from the infant heels, and the card are safe for testing. So now may I call Ms. Laurel for the continuation of the case disorder.
So we will now proceed in case disorder. That includes the sign and symptoms, amino acid disorder, and definition of terms. Next slide, please. Good day, I'm Joyce and Laurel, and I will discuss the sign and symptoms of phenylketonuria together with Miss Vienne Carle Zablan. Within the few first months, an infant with classic PKU could look healthy or normal because this condition produces no symptoms in infants at first, and newborns with PKU rarely have symptoms right away. If a baby is not examined and it has an undiagnosed PKU, he or she might exhibit signs and symptoms as early as a few months of age. Next slide, please. A few PKU babies could appear sleepy or drowsier and much more listless than normal. They could be having feeding issues too, due to controlling and lowering the amount of natural protein intake by giving less breast milk or standard infant formula in combination with a phenylalanine-free infant formula. They could experience thinking, mood, behavior, and growth issues as they remain to consume phenylalanine and protein through their diets. Without treatment, babies typically establish PKU symptoms only a few months. Next slide, please. If the baby is not managed for PKU throughout few months, these preceding are the signs and symptoms that will emerge. As what I've said earlier, an infant with classic PKU could look healthy or normal, and if it is left untreated for a few months, it could lead to mild to severe condition. Another one is a musty or mousy odor of their breath, skin, urine that has too much phenylalanine in the body. This musty or mousy odor is the result of phenylacetic acid, which is a byproduct of phenylalanine. We have here seizures, tremors, or trembling and shaking. Symptoms develop slowly over several months as phenylalanine builds up in the blood. If not treated, affected infants progressively develop intellectual disability over the first few years of life, which eventually becomes severe. That would be all in my part, and here is Miss Zablan for the continuation.
For the continuation for signs and symptoms, we have here the fair skin and hair resulting from impairment of melanin synthesis. This is the most characteristic cutaneous manifestation of PKU. So infants or children with PKU have lower melanin, so it's substance that gives color to the hair and skin because the phenylalanine is broken down, and one of its products used to make melanin. So this often have pale skin, blonde hair, and blue eyes. Cutaneous means having to do or affecting the skin. Next, we have the skin conditions such as the eczema, also known as skin rashes, because this increase the levels of PHE and the product of its breakdown. Next, we have increased incidence of pyogenic infections and keratosis pilaris. The pyogenic infection, this is a local inflammation of skin, soft tissues, and bodily parts, while the keratosis pilaris is seen at a higher rate in PKU. Decreased number of pigment nevi, or this is what we call the moles. It is usually brown or black and flesh colored. So the scleroderma, like flakes, this is caused by excess collagen production that leads the skin to tightening and thickening. This happens when the immune system causes the body to make too much of the protein collagen, an important part of your skin. Then last for this slide, we have the intellectual and learning disabilities and difficulties. The most common finding overall. PKU is known to have a devastating effect on intellectual development early in life. And for the learning difficulties, if left untreated, it can damage the brain and the nervous system. Then next for the epilepsy, so this is the disorder of PHE metabolism that frequently result if a low diet of PHE diet was not implemented at birth. So next, the extrapyramidal manifestation or the Parkinsonism. This is a brain disorder that has inability to sit still, involuntary muscle movements or uncontrollable movements such as shaking, stiffening, difficulty in balancing and coordinating, and stiffness of muscles and involuntary facial movements. Eye abnormalities, the hypopigmentation. This is the patches to the skin that are lighter than the overall skin tone. And this has been attributed to impaired thyroxine metabolism due to hyperphenylalanemia. So about 1/3 of these children are never able to walk and 2/3 cannot talk. Then light sensitivity, this is the photophobia, then hair loss, then the excess phenylalanine damages nerve resulting in brain damage. So here, this is the most severe form of the disorder of classic PKU, which result in the high level of PHE. Then we have vomiting and diarrhea. So the vomiting is due to a toxic effect of the phenylalanine on the brain, and the diarrhea can cause by variety of tissues and occur when low blood PHE concentrates on a longer period of time. Then the mental retardation and mental health disorder. The mental retardation is occurs when a person consumes too much phenylalanine, while the mental health disorders, for example of this is the anxiety, depression, and many more. Delayed development by the age of 1 year old, children are developmentally delayed. So this is because the developing baby in the uterus can be exposed to a very high levels of phenylalanine. So this can cause low birth weight, slow growth, small head, behavioral problems, and heart disorders. So for the jerking movements in arms and legs, this begins about 6 months of age. Mood disorders, for example of this is the irritability, hyperactivity, anxious, agitated, depressed, suffer from phobias, and reduce positive emotions. Usual small head size, or what we call the microcephaly. This is the abnormal small head. Then we have the hyperactivity. Individuals with PKU could have a greater predisposition to the development of ADHD. Then lastly, we have the sun growth. This is the impaired growth and development that experience a poor nutrition and so on. So for the amino acid disorder,
So, today everyone, today I will be the one who will be discussing the amino acid disorder. So, a rare genetic condition where the body develops an excess of the amino acid called phenylalanine. The phenylalanine hydroxylase or PAH gene, an enzyme that transforms the amino acid phenylalanine into tyrosine, a precursor of several critical hormones, as well as the skin, hair, and eye color, is the cause of PKU. The enzyme needed to degrade phenylalanine is produced in part because to this gene. When a person with PKU takes protein or aspartame, an artificial sweetener hazardous debris could accumulate since these individuals lacks the enzyme needed to break down phenylalanine. Next slide, please. Okay. It may potentially result in serious health problems, accelerated developmental delay, a small head circumference, convulsion, and behavioral issues are all results of persistently elevated phenylalanine levels in the blood. So it may be possible to recover a normal phenylalanine levels and intelligence with the use of special formulae and protein and phenylalanine pre-food products. However, treatment may be ineffective in a small percentage of PKU cases when the phenylalanine hydroxylase response cofactor biopterines metabolism is compromised. So that's all for the amino acid disorder, and I will call the other reporter.
Okay, so as per the definition of terms, first we have the phenylketonuria, also called as PKU. It is a rare inherited disorder that causes an amino acid called phenylalanine to build up in the body. Next is the phenylalanine. It is an essential amino acid with the formula C9H11 and O2. It can be viewed as a benzyl group substituted for the methyl group of alanine or a phenyl group in place of a terminal hydrogen of alanine. Next is we have the arrowroot or the Maranta arundinacea. It's a tropical tuber native to Indonesia. It's usually processed into a powder also called arrowroot flour. The powder is extracted from the plant's rhizome, an underground stem with multiple roots that store its starch and energy. Next. We have also the ghee, a glass of clarified butter from India. It is commonly used in cuisine of the Indian subcontinent, Middle Eastern cuisine, traditional medicine, and religious rituals. Next is for the aspartame, a low-calorie sweetener that has been used for decades as a way to lower one's intake of added sugars while still providing satisfaction from enjoying something sweet. Next is the myriad, a countless or extremely great number.
Lastly is the Guthrie test, also called the PKU test, is a diagnostic tool to test infants for phenylketonuria a few days after birth. To administer the Guthrie test, doctors use Guthrie cards to collect capillary blood from an infant's heel, and the cards are safe for later testing. Next reporter, please.
So, good day. My name is Rhonalyn A. Labrador, and I'm here to discuss the nursing implication and health teaching. So, here we will discuss what should be and should not be eaten by an infant or an individual that has phenylketonuria, and also the things a parent of an infant with PKU should know and take into consideration. So first, let's talk about diet regimen. So children with PKU can process an amino acid called phenylalanine or PHE. So when an infant is born, it is a must that a PKU test should be done. So no sooner than 24 hours after birth. So this will guarantee on early detection that will be a big help. In the odds of minimizing the symptoms. A kid with PKU can grow and develop normally with therapy and dietary restrictions. PKU is treated with a particular diet, and newborn who test positive for PKU are immediately placed on a phenylalanine-free formula. Next slide, please. So if the PKU test comes back positive, the newborn will immediately put on phenylalanine-free formula. The formula will sustain the newborns with essential nutrients such as carbohydrates, fats, vitamins, minerals, and all other amino acids, of course, except the phenylalanine. The formula for people with PKU is a must, and it is a restricted diet that will give them the essential nutrients they need. This formula may be needed at any age for the person to get the right amount of calories and essential nutrients. Next slide, please. With the discovery of the low content of phenylalanine in breast milk in the early 1980s, breast milk supplemented with phenylalanine-free formula became an appropriate dietary therapy for newborns with PKU. Before the discovery that breast milk has a low content of phenylalanine, the infants that are diagnosed with PKU or phenylketonuria are instantly weaned from breastfeeding so that they will be accustomed to phenylalanine-free formula other than their mother's milk. Now, breastfeeding is encouraged and well established in PKU patients. Moreover, breastfeeding is shown to positively affect weight gain in patients with PKU during their first year. Now, may I call on Ms. Leviste for the continuation.
Okay, so for the continuation for the diet regimen, as babies start to eat solid food, their diet will need to be closely monitored. Here is the list of food that people diagnosed with PKU can eat without having to calculate phenylalanine content or restrict how much they consume. So as newborns start solid food, their diet must be supervised. People with PKU may eat this item without calculating phenylalanine levels or limiting consumption. For fruits, apples, apricots, banana, berries, cherries, melon, orange, pears, pineapple, plums, etc. Next slide. For vegetables, we have beetroot, cabbage, cucumbers, garlic, green beans, lettuce, peppers, tomatoes, and etc. Starches, arrowroot, cassava flour, cornstarch, and sweet but not white potatoes. For fats, butter, ghee, margarine, and vegetable oils. For beverages, aspartame-free drink, including coffee, tea, fruit juice, and low-protein plant-based milk. For herbs and spice, we have allspice, basil, cinnamon, chili powder, cumin, garlic, ginger, nutmeg, oregano, paprika, pepper, etc. Next slide. And the next is the aspartame alternatives. We have acesulfame K, saccharin, stevia, sucralose, fructose, sucrose, maltodextrin, mannitol, sorbitol, and xylitol. So since a PKU diet restricts protein, phenylalanine-free protein supplements might assist you in meeting your protein requirements. Supplements may also be required to compensate for nutrients missing in the diet, such as vitamins, minerals, and essential fatty acids. So phenylalanine-free protein supplements may help PKU patients satisfy their protein needs. Vitamins, minerals, and essential fatty acids may be needed as dietary supplements. Next slide. So for the food restrictions, so there are several food limitations for people with PKU. And because most of the diagnosed patients are infants, we must consider their main diet, which is breast milk. Although breast milk includes phenylalanine, it is still advised owing to the myriad advantages. It provides low levels of phenylalanine that is found lower than any formula on the market. However, it is still advised to minimize breastfeeding by delivering a defined amount of phenylalanine-free infant formula between 30 and 60 ml before each breastfeeding. So most PKU patients are newborns, thus breast milk is their major diet. Breast milk contains phenylalanine, and yet it's still recommended due to its many benefits and lower amounts than any formula. To reduce breastfeeding, provide 30 to 60 ml of phenylalanine-free formula before each meal. So let's proceed to the next reporter.
So in continuation of food restriction when breastfeeding, the mother diet must be regulated, especially to excessively high aspartame intake, which is equal to around 17 cans of Coke or 100 packets of equal sweetener. This can slightly increase the quantity of phenylalanine in breast milk. Aspartame is widely found in diet soda, chewing gum, gelatin, ice cream, morning cereal, sugar-free cocoa mix, and tabletop sweeteners. Diet beverage with the low-calorie sweeteners may increase the risk of vomiting in the breastfeed babies. Next slide, please. After a large-scale single dose of aspartame, phenylalanine concentration in milk revert to baseline within 12 hours. To determine whether the item contains aspartame, we must examine the ingredient list. There are several methods for ensuring that each meal is truly monitored. For example, to have as precise as possible, we have to use standard measuring cups and spoons, as well as the kitchen scale that reads in grams to measure meal servings. Use the food list to compare food quantities to determine the amount of phenylalanine consumed each day. Next slide, please. Because there are natural protein sources that contain too much phenylalanine for children with PKU, as a result, the infant is unable to consume meat, milk, or other typical protein-containing meals. This is particular diet that a person with PKU must follow to in his or her lifetime. The following foods are rich in protein and should be avoided in child's diet: in poultry, eggs, chicken, and turkey. While in meats, there are beef, goat, lamb, and pork, seafood, fish, and shellfish. In dairy, there are cheese and milk, legumes, beans, peanuts, peas, and lentils. While in grains, there are barley, oats, rye, quinoa, and wheat. While in nuts and seeds, there are almonds, hazelnuts, cashew, flax seeds, hazelnuts, pine nuts, sesame seeds, and etc. And lastly, in supplements, there are protein powder including both animal and plant-based products. So in references, we have complied this references link. So these are the references of our group presentation of our journal. So that's all of our group presentation. We are the group 4. Thank you.